Good evening, everybody. Thank you so much for joining me. My name is Sarah Clark. I'm going to be your presenter this evening. We're going to be reviewing Stress Less, product selections to relieve stress for both the patient and provider. A little bit of background about myself before we get started here. I'm a dental hygienist. I've been practicing for 7 years now. My passions are really based around patient care, taking care of yourself as a provider, practicing more stress-free, and also including advanced practice techniques. So that's a lot of what we're going to talk about this evening. So as we move forward here, we're going to actually start by talking about some facts about stress. Let's take a look at some statistics about stress in our society, because we do know stress is definitely a problem. I'm sure if you're here this evening, you know stress probably pretty well in your own life too. I think we all do, especially as dental providers. So looking at some statistics about stress in our society. Number one here, 43% of all adults actually suffer adverse health effects due to stress. So almost half of our adult population and the general population is experiencing some sort of adverse health effect because of stress in their daily lives. These statistics are actually taken from the American Institute of Stress in Yonkers, New York. They do a lot of research regarding stress in our society. They have some pretty fascinating statistics if you'd like to take a deeper dive into any of these as well yourself. The second statistic we have here that is really mind-blowing in regards to stress is that 75% of visits to primary care doctors are actually tied back to stress-related complaints or causes. So anytime somebody like you or myself are going to the primary care doctor for whatever reason, typically 75% of the time, those reasons are linked to stress. So maybe it is a physical manifestation of that stress that they're feeling. It could also be mental in that regard, but that's a pretty high percentage of primary care visits. Also, 1 million people every single day are absent from their jobs because of stress. This is, again, that mental toll that stress can take on us, that physical toll, and that's a pretty huge problem. 1 million people is definitely nothing to joke about, and it definitely shows us that stress is a very pertinent problem in our society. So what are some of the current problems with this career stress? We talked about how it really affects a lot of our population. Let's take a look at what the effects of those people being affected truly is. So $300 billion every year is actually the cost of job-related stress. So those 1 million people that are out, those people that are seeking care at the doctor, people that are maybe unable to function fully to their capability in their job duties, leads to $300 billion every year in profit loss. So think about how much money in the dental industry can be lost because of this. That's pretty crazy. 60 to 80% of accidents, so those industrial accidents, can also be related to work stress as a primary cause. That is a huge number too. So when we think of industrial accidents, again, these are overall statistics. So it can be things like construction accidents, but think of what stress can do to us in the fact that our minds get distracted, we become tired, we're maybe not as alert. Those things can still affect us in dentistry as well. Think of if we're not on the top of our game, what can we miss in patient care? What can happen with us when we're handling maybe sharps, needles, all of those other things. There's a lot of little details that we're working with. So that's a very alarming statistic that we want to be able to be on top of as well. And probably the craziest one for me that I found to be super shocking when I started doing my research on stress is that 9 out of 10 job stress lawsuits are successful. So we think about getting hurt on the job, right? That could include, again, those industrial accidents occurring. People may have lawsuits for that, workers' comp lawsuits, and we expect a lot of those to either settle or potentially become a win on the end of that side. But for lawsuits related to on-the-job stress, 9 out of 10 of those actually end up with a monetary payout. So that stress that we're going through every single day can essentially be litigated and paid out. So that's a huge, huge concern for all of us. Now, when we start to take a look a little bit deeper, because that was really about our overall society, and just to give you an idea of how effective stress is on all of us in society, let's take a look at exact statistics here for dentistry. So the first one here, 2.5 times, that is the amount that we as dental professionals experience psychoneurotic disorders compared to our medical counterparts. So those in the medical field, physicians that are seeking care for these psychoneurotic disorders, we're doing that 2.5 more times, or we're 2.5 more times likely to do that than them. That's pretty amazing. And not amazing in a great way. We definitely don't want to be at the height of that statistic, but the truth is currently that we are definitely at that height of that statistic. Number 3, for us, stress is the 3rd most common complaint on our list of chief concerns when we're seeking primary care. The general population tends to be 10th. So I know we talked a little bit about that 75% of primary care visits, 43% of all adults are experiencing that stress. So a lot of times those things, people may not realize stress is the true source of it. So when it comes up on the list of actual reported chief complaints, the general public is reporting it 10th. We're reporting it as number 3. And this last one really, really gets me here, because the number 1 killer of dentists has actually been determined to be stress-related cardiovascular disease. Whenever I present these statistics in person to a room of individuals that I can see, I always ask, who can raise their hand in here if they've unfortunately known a dentist who has passed because of stress-related causes or cardiovascular heart attacks and things of that nature. So whenever I ask the heart attack question, I always get at least 1 to usually 3 or 4 hands that go up in the room. So I've never had anybody not put a hand up in a room yet, and that just is really shocking in the sense that it brings the statistic to a true reality that stress is absolutely a problem in our career. So what are some of the risk factors in our career that can be leading to these statistics, or that we know? I'm sure all of you could list off a lot of the things that stress you out, but some of the things to think about here. Number 1, we've got physical pain down in this bottom left corner. So dentistry is taxing on the body. We're hunched over a lot of the time. Ergonomics can't always be ideal. Things get sore. We have other ailments from just living life, aging, and all of that. And that all comes into play and creates some stress for us for sure. We have direct patient care. Patients are exhausting. We love them dearly, but it takes a lot of energy to be 100% on all the time, match their emotions. We're dealing with anxious patients. Us ourselves can be anxious in certain situations. So that's a huge, huge source of our career stress, and actually one that we're going to talk about for a majority of today as well. Too many tasks is another one. I see a lot of times that whole 60-minute hygiene appointment. What are we doing in those 60 minutes? That list tends to be growing expansively. That 60-minute appointment, we're continually adding duties onto, and rarely are we ever taking them away. It can start to feel like a lot and sometimes too much. And so that's definitely a prominent factor in that risk for career stress. We also have a toxic environment. So unfortunately, I myself have experienced this, and I know a lot of other dental professionals have as well, where the current job environment that you're in for whatever reason, it's just not necessarily a good fit 100% of the time. And sometimes that can go even as far as actually causing excess stress on us. So it's definitely a risk factor for that career stress. And also small businesses. Dentistry, 95% of the time at this point, I would say, is a small business. So dentists are owners, in some states, even hygienists are owners, and paying the bills, things like COVID come up, having to make sure that you're responsible for patient care, employee care, benefits, hiring, firing, coordinating all the training. I know if you've ever seen the front end of a dental office and how everything has to be coordinated and the administrative duties that go along with it. I mean, there's a whole lot of paperwork and a whole lot to be responsible for. So that is absolutely a risk factor for career stress as well. So when we take a look at all of these together, there's a whole lot of things in our own careers that are responsible for creating stress. So let's talk a little bit about stress. One of my favorite things to typically ask attendees is, can you define stress for me? And a lot of times people kind of look at me and give me a scratch on the head and say, I've never actually really thought about it before. I know what stress is. If I were to say stress to somebody, we all have an idea of exactly what stress is and what it means, but to put a true definition on paper is very difficult. And the reason for that is because there are so many different types of stress, and there's actually varying definitions of stress depending on certain situations. So there's not actually a true definition for stress, but let's talk about some of the different types of stress. Typically, whenever we're thinking about stress, we always think about it in a negative term, and that's not always the case here. So you can see where we branch off of stress. At the top, we have something called eustress. So eustress is actually good stress. There is a such thing as good stress, and that's really important to know. That's why we've got that smiley face up there. Some examples of eustress. Working out, you're doing something good and healthy for your body has been put under stress at that time. Even some emotional good stress, having a baby, getting married, buying a home, they all put stressors on you, but they're good sources of stress. So we call those eustress. The type of stress that we're really concerned about and wanting to focus on are distress. So even distress can be broken into a couple different areas of stress. We have chronic distress and we have acute distress. We're going to take a little bit deeper look into both of those here and understand the true differences and how chronic distress is actually where a majority of these statistics and issues are coming from, where acute distress is a bit different than that. And most of you will be familiar with acute distress. So what is acute distress? So this is going to be our fight or flight response. So this is when you're in a moment, your body sends a signal to you saying, we've got to get out of here, for whatever reason it is. Your digestive system shifts, your blood flow shifts, your breathing, all these things are happening very, very rapidly. And this is an innate response that's trying to get us out of a dangerous situation. Way back when, this was when we were, just for the sake of example here, cave people running away from saber-toothed tigers. We knew that we had to get away from the threat as quickly as possible, and our body prepared us to do that. And then we have chronic distress. So chronic distress is actually being continually exposed to a stressor. And a lot of times in our current society, that is an acute stressor that we're unable to get away from, putting us under a chronic stress toll. For example, whenever you're in the dental office, you're seeing a patient and a stressful situation comes up. Maybe it's a confrontation with a patient who's not being so nice to you, and maybe it's an employer or a coworker, whatever it may be in that moment, and this conflict arises. Well, your body is going to start telling you with that acute stress response to get the heck out of Dodge. But unfortunately, knowing the potential negatives of leaving the job at that time because of that situation or whatever it may be, our social constructs, we're going to stay in that environment, force ourselves to kind of put away those feelings for the time being as much as we can and move on with our day. And that's really unhealthy for us to do, but that's the way our society is structured at this time. So because of that, that repeated exposure to stress can lead to a whole sorts of different medical things here, like depression over time. The more we're exposed to it, we can become depressed. Appetite changes, that can actually be increase in appetite or decrease in appetite. Everybody's different in that. Frequent minor illnesses. So if you think of a lot of those people who have that weaker immune system, who get sick really frequently, burnt out, they're frequently run down. That can be because of this chronic stress. Chronic pains, lots of muscle tension, aches, backaches, headaches, gut discomfort. That can be because of chronic stress. Addictive behaviors, a lot of times we lump that in with drug use, alcohol use. That's not always the case. Addictive behaviors can become other things as well. Chronic working out. I know working out is typically a great thing. Some people will use it as an outlet in other ways that can actually become harmful. Other obsessive behaviors and addictive behaviors like that as well. And fatigue, the people that are just really tired all the time. The body's continually dumping out those hormones related to that acute stressor. And we're just unable to kind of fight all that off and put it away, putting us into these chronic stress changes. So why do we experience this stress again? That's back to that innate piece where long time ago, just as if we were living out in the wild like animals do today, we really needed it to keep us safe. We'd be in a situation, our body relied on this response to tell us, hey, get out of here. But unfortunately, now we're being forced to stay in these stressful situations longer and longer, turning this into a chronic stress issue. So, as dental professionals, now that we know a bit about stress, something that I want to challenge you to think about is a lot of the pain that we experience physically practicing just poor ergonomics, or could some of it actually be sourced from our stress? While thinking on this has led me to believe that we have something called the mental and physical stress cycle here. Stress releases hormones. So that can be, again, starting with that acute stressor. It can be all of those mini stressors through our daily lives building up. Let's face it, we don't drop all of our stress from home just because we walked into the office. We might be able to kind of tuck it away for a while, but realistically, the physiological aspects of that stressor are still going to be going through these certain processes. So that stress releases these stress hormones. A common side effect of those stress hormones is to create muscle tension. So now we know that you think of people with their shoulders kind of up to their ears when they're stressed. I always tell people, get your shoulders out of your ears. That's that muscle tension piece that comes into play. So we release the hormones, we create the muscle tension. From that muscle tension, staying contracted all the time, we actually get physiological pain and discomfort. Could you imagine walking around with your arm flexed for 5, 6, 7, 8, 10 hours a day? I know my arm would get sore and tired after that. Same thing with our muscles, shoulders, necks, backs, you name it. All of a sudden we get that pain and discomfort. Well, pain and discomfort is also a stressor. So it's going to continue this cycle on and on and on because we get the stressor, creates the hormones, creates the muscle tension creates the discomfort then creates more stress. So you see where I'm getting at here? We need to be able to break that mental and physical stress cycle. So let's take a look at the clinical environment in stress. So we want to be able to adapt our environment to be less stressful on us. And that's going to have a huge component coming into play on patient management. We're going to talk a little bit more here about what that means and why patient management is so important in that. So the first thing I want us all to think about in patient management is Maslow's hierarchy of needs. So that might be something that we haven't actually looked at or talked about in quite some time. You might have to think way back to school here the last time you looked at Maslow's hierarchy. But a huge source of our patient stress is those patients that are really on edge. A lot of time they're nasty. And it can really get away from us when it starts to stress us out of what could actually be causing this with our patients. So thinking back to Maslow's hierarchy of needs, I challenge you to say, where is my patient potentially at on Maslow's hierarchy of needs? Because that can actually play a role in their attitude towards me in the dental environment. Also, think of where you personally are at on Maslow's hierarchy of needs. As we start to take a look at this, we know that some of our patients may not even have the safety piece. If they don't have that piece, they're not going to be having the esteem piece. Love and belonging could be a struggle for them. It's going to be really hard for them to open up and be comfortable in our dental chair. The same thing can happen with our coworkers. The same thing can be happening with us ourselves. So this is my cue to take a look at this and just give our patients a little bit of grace. I know that can be really hard as well, but a big stress reliever can come from giving some empathy towards understanding where others may actually be at. And one of the reasons that our patient's energy can affect us so greatly, and I know for some people, they're like, what, are you kidding me on this? But no, this is actually really scientifically proven here, is that about 15 inches surrounding us, pretty much actually, if you were to take your arms out and kind of make a bubble around you, we have been proven that we have energy force fields. So those force fields will tell us and read into other energy that is within that area. So that is actually the reason that if someone were across the room from you, threw something at you, but you didn't actually see it coming at you head on, If you were to put your arm up, or you'd kind of block it with your own reflexes. And that's why, because the second that object enters that energy field that is surrounding you, you're able to put your blocks up. The same reason for that is why we feel the tension when we walk into a room. That's where that saying, cut the tension with a butter knife, kind of comes from. If something bad happened in a room before you even got there, typically you can go in and you've got a pretty good idea that something just went on. Same with this force field. We are working in people's bubble like this all day, every single day. So it's very easy for patient care to leave us exposed to these emotions, and really why we want to focus on that patient care piece to make us more comfortable. So one way to start doing this is to start seeing what our patients are telling us for signs. If we can get really good at understanding and reading patient body language and the signs that they're giving us, then we can start to really predict how are things going to go for us, what's potentially going to affect us, what can we do about it. So number one, start thinking about where our patients and ourselves are in Maslow's hierarchy. Number two here, what is their body language telling us? When we go out to the reception area, that's a great time to start screening, looking around the room, saying, hey, I'm going to go get that patient over there. What are they exhibiting? Pulling the lips back when we're looking at the mouth. So that's if you think of like really thin lips where the commissures are kind of pulled back toward the ears, blocking their mouth with their hand. Those are common signs of anxiety. So everything listed on this slide here is actually a sign that somebody is nervous, anxious, untrusting. So they're good things to keep in mind. Legs as well. If they're sitting down in a chair, or when you sit them in the dental chair, if you notice that they point their knees away from you towards the nearest door or exit, wrap their feet around the legs of a chair, are continually tapping their legs, those are signs that they're preparing to get up and have an exit. Using their torso to turn away from you, pulling the shoulders inward to cover the chest area with the arms, that's actually a way that we subconsciously try to protect our vital organs. So we keep that heart and those lungs closed off without even realizing it. That's because we're really unsure about the situation. With arms, we can be closing them, hugging oneself, so we tend to see the folded crossed arms. That's not necessarily because somebody's mad, it's because they're uncomfortable and anxious in that situation. Hands. So I know that, and you all know that when your patient is in the chair, they're obviously going to be a lot more vulnerable. So they're laying straight back. We kind of have control there. But one thing that I tend to really try to do is, it's kind of like checking the mirrors of your car. You're driving down the highway, you look at the rear view, you look at your side view mirrors. Well, with the patient, I may be working, but I'm always constantly looking up. I'm trying to look at their eyes, and I'm trying to look at their hands and what are their feet doing. So the hands that squeezing together or rubbing, they could potentially be doing that, or commonly in the dental chair, gripping the arms of the chair. Also, head. So if you're walking them back, this is a really good time where even though I'm leading the way, I may turn around to kind of talk to them. And if I see that they are having their head tilted to the ground where they're kind of looking at their feet walking, they're exposing the crown of your head to you, it typically means that they're anticipating danger or very uncomfortable. The reason for that is by tilting the chin downward, we're protecting the throat area, which is another vital area. And a sign of friendliness or trusting is eyebrows being raised. So whenever you go and greet your patient, see if they give you a smile back and raise their eyebrows. So this is something that was actually observed in chimpanzees first before we determined that it was actually applicable to humans as well. So whenever you go to greet somebody, or when chimpanzees are friendly towards each other, they typically get an eyebrow raise. So same with humans, somebody that's comfortable with you is going to give you that eyebrow raise back. Somebody that's not as sure yet, you're not going to get that eyebrow raise. So it's a really good way to get some validation, how somebody may be feeling about your interaction in that moment. My goal by the end of the appointment is to get these signs to go away. I want my patient to be comfortable, as I'm sure you all do as well. So they're great signs to get a heads up of where your patient is at before you get them in the chair. So what are some things that we can do to help keep our patient comfortable so that we can then be comfortable, not exposed to that anxious, nervous energy? helping us to alleviate our career stress. Let's take a look. These are all things that I have personally used and keep in my armamentarium daily that I could not work without. So the first thing we tend to hear from these patients, right, is don't touch me with air, don't touch me with that metal thing, I don't want it. And we're kind of like, well, how am I supposed to do my job, right? Well, of course, we know that we're going to be able to get our patient to comply with that and understand, hey, this is just what we need to do. But we can take it a step further and say, I've got something that's going to help make you comfortable through that. I'm here to make sure that you're comfortable. And then we're going to be able to build that trust level with them and relieve their anxiety and relieve our anxiety as well. So hypersensitivity, that first piece that a lot of patients are really anticipating, that's when we tend to get the jumps out of the chair to the roof that we don't want to have. So a little story about hypersensitivity that was really prominent for me in my career. I worked in a practice that I took over for a hygienist who used to use microprime, which is a common desensitizer, on pretty much every single one of her patients pre-scaling. And so now all of these patients were coming in and going, are you going to do that paint on stuff before we get started? Because now they're all psychologically convinced they cannot tolerate a hygiene appointment without having microprime. And I'm going, oh my gosh, how am I ever supposed to microprime every single tooth on every single patient just to do their hygiene appointment? It's never going to happen. It's a huge time suck. It's a waste of materials. These patients don't trust me if I don't do it. So finally, I was able to be introduced to Admira Protect. And this took a little bit more time up front. But once I began to get it implemented, it was life-changing for me. So Admira Protect comes in these little pouches like you can see on the slide there. They're really great because with a microbrush, you just puncture the foil seal, dry the tooth, which if your patient is really sensitive, again, they're going to be like, maybe don't touch me with air. You can use the 2x2 to dry any of the areas that are root exposed, sensitive for the patient. Place it on a very thin layer of the product, the Admira Protect, on those areas. Disperse it very lightly with a faint burst of air, and then you go ahead and light cure it. The great thing is I was able to tell my patients, hey, I've got this new product out. It's going to do exactly what the old product that you had used to do, but we only have to put it on you once every 2 years, or it can last even longer. So let's go ahead, spend a little bit of time using this product today. And then until you start to notice becoming a little more sensitive later on, which is probably not going to be for at least 2 years, we don't have to worry about it, meaning your hygiene appointment can be a lot quicker and more comfortable. Every single person totally sold. There are ways that you can bill this out. A lot of times you can do a D9910 desensitizing code. I was fortunate to work in a practice who opted to do this as a service to our patients. That's something that I also strongly consider. I don't believe that we need to nickel and dime for everything that we put out there. I know a lot of people are going to have different philosophies, especially those looking at the books, but my thought is these patients are going to come back. Word of mouth is going to come out that you are taking the extra time and care of your patient. It's going to make your job easier, your patient more comfortable, because then we're not fighting about, do you want to pay for this service to make you more comfortable? That tends to come up a lot. So if it can save you a little bit of sanity, spend a couple dimes and pennies now because it's going to profit for you in the long run. So Admira Protect was something that I worked with very, very heavily. If you're not wanting to spend quite as much time, but you're really wanting to get a significant boost in your desensitizing, another great option is Pro-Fluoride L. So this is not particularly a fluoride varnish. However, it can be used as one because it does have the 5% sodium fluoride in it. But what's really cool is that it also has a 5% calcium fluoride in it. In Canada, it goes under a different name. So if you're out there, it's going to be bifluoride 10. But here in the US, it comes in a similar packaging to the Admira Protect. However, it does not need a light cure. The little foil packs are good for about a quadrant of material. So that's another reason that it's not the ideal necessary product for a fluoride varnish, but you could use it as one if you didn't have another product in the office. The taste is a little bit more medicinal, but overall, it's a really phenomenal product. The way that I've actually used this product in practice was after scaling and root planing appointments. So I actually had a patient For the sake of sharing a little bit about him, his name was Phil. That's a false name, but we'll call him Phil. And he was coming in for scaling and root cleaning appointments. He had a lot of recession in a lot of areas, but still deep pocketing. So we tried quadrant number 1 on Phil. He came back 3 days later, super, super hypersensitive. And of course, he hadn't had a hygiene appointment in like 30 years before that. So he was like, I don't know if I'm going to go through with the rest of my care. So I wasn't in the place that I felt like we really needed to cover every surface of every tooth with Admira Protect and Light Cure It. I knew that we could get him back to a comfortable place by utilizing this product. So I placed the product and he was good to go. Didn't have any more sensitivity after that. So then at his next scaling appointments, what we did was post-scaling, we automatically put the Pro-Fluoride L on. It gave him some benefits of remineralizing the tooth surface, also significantly helped him prevent that hypersensitivity moving forward. It's an awesome product for anybody who might have a pine nut allergy as well. And here's a really great one. So guided biofilm therapy. This is our up and coming shift in the hygiene appointment. So if you haven't looked a lot into guided biofilm therapy yet, I highly, highly recommend it. So why is guided biofilm therapy different than our typical hygiene appointment? Well, first, it's a totally different process. It's not just a tool. It's actually a full process, an 8-step. We're starting with an airflow, and it's not your grandma's air polisher by any means. This air polisher is meant for patient comfort. The reason for that is it starts with an erythritol powder. The particle size is incredibly small in the erythritol powder, but the particle is actually very, very strong and hard, and it has those antibacterial properties as well. So if you were to actually feel the powder between your fingers, it kind of feels like baby powder. It's super thin, but super effective at removing stain and the biofilm. Most patients that have it say they really enjoy the taste. The water has some warmth to it, so we're not worried about the discomfort from cool water being exposed. And it helps to just get all of that stuff out of the way. When I say stuff, of course, I mean bacteria, stain, all of the stuff we don't want to be sloshing around with a scaler in there. Makes the appointment much more efficient and comfortable for the patient in that regard. The Piezon technology that comes with it is really cool. The tips are actually meant to move and oscillate in their own way, that they're not going to be as harsh on the enamel surface in the way that they're contacting. They're much more comfortable than an ultrasonic scaler in that regard. And the water from the Piezon tip is also heated. It's pretty great. It has adaptive response technology. So whenever that tip is contacting an area that there's no calculus, the power will adjust itself down, versus whenever it finds calculus, it's going to adjust itself up to be able to remove that. So it's an incredibly smart machine, very minimally invasive, more efficient, meaning your patient's going to be more comfortable. So next here, we're going to talk about I don't like that stuff. So how many times do we introduce products that patients are like, I really don't like that product. I don't want to do that. I hear it a whole lot, right? I'm always seeing debates in Facebook forums about what fluoride varnish do you all like? What prophy paste do you all like? So I'm going to share with you the products that I use that I really enjoy. We're going to talk about the Pro-Fluoride varnish. So I know we already talked about 2 other Voca products with the Pro-Fluoride L and the Admira Protect, but for my daily regular use varnish, I'm a huge fan of the Pro-Fluoride varnish. Number one, we don't have that like goopy, chunky, white, gross texture. It's very, very thin. It goes on translucent. So you're not going to have that weird, chunky texture that most patients complain of when you place a fluoride varnish. The flavors are also really good. I've had some fluoride varnishes where the flavors, I'm like, I don't know if that really tastes like that. But Voca's always had some really amazing flavors. The caramel being just really hit it out of the ballpark, awesome flavor. And we now have the new pina colada flavor, which I love, the sort of coconutty sort of flavors. So that one's been really refreshing. People love it. It's a great product because of how natural it is overall. So my patients that appreciate more natural options are really appreciative, which is also another way that we get our patient to be more comfortable. We use products that are comfortable for them, and we also keep their thoughts and their ideals in mind. So for those patients that are more health conscious and asking questions about, hey, what is exactly in the product that you're using on me? This is a great thing to have to share with them. Like, hey, I'm choosing products that are health conscious. I did actually write a more in-depth article specifically about fluoride varnishes and perfluoride varnish in 2018 in RDH magazine called Fluoride Varnish, the Who, What, When, and How. You can go take a look at that. It gives you some great thoughts on case acceptance and why picking a fluoride varnish that is comfortable for your patient is going to be really beneficial as well. Now we have Prophy Paste. As a hygienist, Prophy Paste can make or break your day. And it sounds kind of silly because it's Prophy Paste, but it's so totally true. I know it's always a constant fight of how is the rinsability? Is it flinging around on my Prophy cup when I'm using it? What do the patients think of it? Because how many patients hate it? A lot. I was always like apparently the weird kid that loved having my teeth polished, and I loved the grit as a kid. But now I can't believe how many patients are like, I hate that stuff, skip it all together, all of that. So it's really great to have a product that is very smooth. Patients enjoy the flavors. Again, they're very comfortable for the patient. The grit isn't as intense. And it's very easy as a hygienist because the rinsability is great. It does a very effective job. And it's got a great color coding system. So rather than trying to figure out which colors are what or reading the fine print on the top of the labels here, we use a stop sign or a traffic light technology where we know that the red is going to be our higher grit, green is going to be our fine grit. So we're able to grab it and go right from there. It's got fluoride and xylitol in it. It's some awesome flavors. We brought the caramel into this paste. So kids love it, adults love it, because I also didn't realize how many adults don't like mint. And there are a whole lot out there. So it's great to have good flavored pastes that are not specifically mint. And here we have it hurts. I don't want that. How many times do we hear that from our patients, right? They're like, I don't want period charting. It hurts. I don't want this, or I don't want you to use the sharp pokey thing when they're talking about our scalers as hygienists. They just don't want to be uncomfortable. And I have to say, I can't blame them. If I didn't know what I knew, I might feel the same way to an extent as well. But rather than kind of rolling our eyes and just being over it, which I'm totally guilty of too, I've been there, I've done it. Let's give them some solutions. It's not that hard to give them some solutions that then make our life easier because our patient's not giving us that jumpy feedback. They're not anticipating our every move. They're not giving us a side eye going, what's that? Every time you pick something up to put in their mouth, because they're okay. They're hanging out and they're cool. So one of the best things that I began implementing was Diclonine rinse. This was something that I know a lot of hygienists used some time ago. It seemed like it kind of died out for a while, but there's just so many good uses. I'm a huge lover of the Diclonine rinse idea. Septidot actually brought back the Diclo Pro, so that's pretty exciting because now you can actually get it from a dental supply company, whereas for quite some time it had to be compounded by a pharmacy. So what Diclonine rinse is it's just a topical anesthetic rinse. So you swish for about a minute. Once you spit it out, any soft tissue that it touches will numb. So the one thing I will warn is that definitely give your patient a heads up before you give them some of this rinse that it is going to numb anything it touches. It lasts about 30 to 45 minutes. So it's not going to go too crazy. It's just going to be enough to get you the anesthesia that you're looking for to do those procedures that patients tend to dread, such as periodontal charting, radiographs for those gaggers. If you need to get some impressions, it can be really great for that as well. And just make sure that after they swish with it and spit it out, that they keep their head tilted forward, give them a cup to spit in for the time being, and they'll be okay. As long as you give them a good heads up where if they do get a little numbing in their throat, it might just feel like they have kind of something like a little frog in their throat for a few minutes. You can give them some water to go ahead and rinse down with it, but it's not going to hurt them. It just might feel a little funny. Give them those heads up. They'll be totally good. But it is definitely a game changer when it comes to being able to get your accurate perio charting or get through scaling an appointment on a gingivitis patient who you don't want to do local. You don't want to bring out all the hard, in-depth treatment stuff of that regard, and you just need a little bit of comfort to get them through. For our local anesthesia givers here, I never knew how much I would adore our electronic systems for local anesthesia until I actually began to use them. So I started out using the wand as the first system that I tried. And it was a game changer for me in providing anesthesia. A few reasons for that on the patient care side. Number one, they don't necessarily look like a needle to the patient. Um, I used to, when I started using the CalJect, it kind of looks more like a pen. So they'd be like, what is that thing? Is it like a pen? Or I would tell children it was a pen. And the wand just, it doesn't have a look like a syringe as well. So patients don't have the visual cue typically. So they tend to be a little bit more relaxed with it. The other thing is we're going to have more even distribution of the local anesthetic. It's going to be injected at a regular rate versus utilizing that thumb to try to keep an even dispersion rate. It's also so much easier to find your landmarks and be accurate in the way that we're holding it, because we're holding it like a kind of like a dart versus putting in the palm of your hand. I always say it's kind of crazy that we have to kind of do this palm up or weird hold with a syringe and then try to feel where we're going while injecting or while hitting a landmark. And it's just a whole lot going on to be comfortable. And it's bulky. You're trying to get your whole hand in there versus just using a very fine tip to be very accurate and precise. Patients tend to love it. A lot of them, when I use the CalJect or the wand, have said to me, wait, that was the anesthetic? Yeah, it was. It's a little bit of a learning curve to get used to. Once you do, you will 100% not want to go back after that. And then the TLC patient, so the tender loving care patient, as we called them in the practices that I've been in, because we all know that we have those patients that do just need a little bit of tender loving care. They tend to get a bad rap as the needy patient, but at the end of the day, taking a couple of minutes to help them feel comfortable is going to make your appointment go so much smoother. So take 5 minutes to give them a few things that are going to keep them comfortable and less anxious versus fight against those impulses where they may be asking you 100 questions through the appointment, need to do this, need to get up, they're uncomfortable. Rather than having a 60-minute session of all of that, just have 5 minutes where you can try to do your best to make them comfortable. So a couple things to help those patients. If they're really anxious, a weighted blanket is a great idea. I know in the times of COVID, we're really trying to minimize certain potential contact surfaces. So I have seen people use a lead apron for this and then wipe it after. I've also seen people get these kind of weighted, they're like a lap like pad that's weighted, and it's more of a plasticky material that you can wipe down, or even getting a weighted blanket and then getting duvet covers and wash them in between. So those are a couple options there, getting them comfortable. Most of the patients that get used to it just say, hey, can I have the blanket today? It takes 2 seconds to get that blanket out. And now we have sound. So there's a lot of office sounds going on in the background. So I always challenge everybody to kind of see what's going on during the day. So if you ever have time between a patient in the morning when everybody else has gotten started, but you haven't gotten your patient yet, go to a central area in your office and just take a couple of minutes and listen. We become very, very desensitized to all of the sounds going on in our dental offices. You walk in, you hear high speeds, there's people talking, all of that. And all of that can be overstimulation for a lot of our patient pool. So providing something like a white noise machine in the room to just sort of keep them in the moment in what's your operatory, what's happening there versus throughout the whole office. Providing some headphones for them, listen to music. If those aren't specific options, let your patients know that they can bring in headphones as well. That's going to help them just drown out some of those other noises that, again, we become kind of desensitized to since we're around them all the time, but they can be anxiety triggers for your patient. Once your patient's been able to settle in a little more, things are, again, going to be a lot easier on us. Positioning. So positioning goes both ways. Number one, to keep the patient ergonomically comfortable. Number two, for us to be able to see. So one of the things that I tend to see kind of go out the window for clinicians is positioning, where we're not necessarily doing the chin up, for maxillary surfaces. We're not having our patient come toward us or away from us, and we're just kind of bending all over. So that is a physiological stressor for us. And for our patient, a lot of the time, they may have reasons that they may be uncomfortable in the dental chair. There are typically a lot of times the patients that say, I can't lay back. Well, maybe they could lay back. They just need a knee bolster so their back isn't in that specific flat position, or something like a neck pillow. And if you don't have those available, you can even take some towels, launder them, of course, after each patient use, roll them up, and then place them where you need. They can become a knee bolster. They can become a neck pillow. Those will definitely help keep your patient in a more suited position for you, as well as more comfortable for them. And then finally, last but not least here, we have to think about our own clinical setup. So what are we working with? This is also something that I see tend to go by the wayside a whole lot here. But we want to make sure that we're using instruments and gear that are going to help us be really comfortable in our work. I understand that a lot of time it's out of our control what our offices may have available at the time. We would all have probably like a $3 million budget every year if we could, right, to get our own stuff. I know I would be buying stuff all the time that I loved, but it's okay to invest in ourselves too. All these things I have bought on my own, minus the airflow machine. I have not bought one of my own yet on that, but my own visor. When COVID hit, I knew that the visors I was going to have available to me probably weren't going to be ideal. It was going to be uncomfortable. So I wanted to make sure I had a visor that I could take with me that wasn't going to hinder my ability to practice comfortably, meaning my patient was going to be more comfortable. Using instruments that you like. Instruments are definitely not one size fits all. I was fortunate to work in an office where half of the hygienists, myself and one other, really loved PDT, and we were able to have PDT cassettes, while the other hygienists really love Hu-Friedy instruments, and they use Hu-Friedy cassettes. Once I left that office because I moved, I actually bought my own PDT instruments because I knew I didn't want to be without them, and it was definitely an investment on my part, but it was 100% worth it to have those things that made me more comfortable. Power scaling. What is your power scaling situation in the office? Is it working for you? When's the last time you got tips? Make sure you've got good working tips. That power scaling is going to save your neck and your back. Patient education materials. Are you sick of repeating yourself over and over and over again? Take a few minutes one day, or have a hygiene team meeting or an office team meeting where you can put together some documentation that makes sense. Some really great ideas for that are perio folders. So if you have a perio program, creating a stoplight system on folders. So early perio, moderate perio, severe perio. What are the treatment stages? What's the follow-up? Start setting that expectation of things that are like your periodontal maintenance follow-up, and make sure that your patients are going to understand what are they about to endure. Have it all ready so you don't have to be a broken record, or your patients are going to be a lot more understanding and retain that information moving forward. I've also done things like product scripts. So for instance, taking a list of all of my favorite home care product recommendations, writing what I typically recommend them for, where they can be found, and their pricing. And for each patient, I would just circle the ones that I would ask them to get, hand it to them, and then I knew that they were going to have access to that information moving forward. So these are all little things that we can implement to help make our lives easier daily. Also, again, that patient care piece, by taking a few minutes to implement these products for ourselves, products that function well for us, make our lives easier, products that are ideal and comfortable for our patient are going to make them happier. We're not going to have as much of their stressed out energy. Our day is going to go a little smoother, and we're going to have a little bit happier day as well. So hopefully today this gives you some good information and insight on some things that you can change during your clinical day and implement in your clinical day that helps to relieve some stress while you're practicing. So at this time, I'm going to go ahead and open up for Q&A. Let's take a look here. So Tammy, hi. Just thought I'd add from Jamie. COVID has made it super stressful as well and has hit many businesses as well as healthcare facilities in a big way. Yes, 100%. I totally agree with you on that. At this time, we're definitely kind of just all doing the best that we can, and we've got to understand that. So these are all great things to implement. You know, our patients, I think, for the most part, are really understanding that we are doing the best that we can at this time. So thanks for that, Jamie. That's a great ad. Anybody else for Q&A? And if not at this time, then we'll go ahead and finish up. Okay, I don't see any more Q&A. Thank you everybody for joining me. If you do have any questions, want to reach out about any of these products or anything and talk more in depth, you can email me at sarahclarkrdh@yahoo.com. Have an awesome night, everybody. Take care.